We are so far apart right now, and the major sticking point is the traveling.
We can't give up on the mobility of care personnel. That's the message Sonia Labelle, president of Quebec's Treasury Board, sent to the Fédération Interprofessionnelle de la Santé, or the FIQ Nurses Union, in an open letter in La Presse on Tuesday, as the issue is at the heart of the labor dispute and negotiations for a new collective agreement. The FIQ rejected the government's latest proposal last week.
It's been tough, it's been frustrating, and nurses are getting agitated.
The point of contention is due to health establishment managers wanting to move nurses from one care unit to another, or even from one institution to another, in order to meet the needs wherever they arise.
We are afraid that we're going to be putting patient lives in jeopardy by transferring nurses to regions where they don't work, to units that they've never worked before.
In Labelle's letter, she says the question is the FIQ ready to work on greater mobility for nurses in the network for the benefit of Quebecers? If so, it is at the bargaining table and through the experts that we will find the way to achieve this. Labelle assured that respect for the training required and the skills of nurses will always be a prerequisite, and that no displacement will be imposed outside the position that the person occupies. She added it would help reduce mandatory overtime.
The problem is the institutions will no longer have the decision-making abilities, because on December 1st, Santé Quebec comes into power. And Santé Quebec is a large bureaucracy, the biggest ever created in Quebec. They're going to be deciding where individuals go. Are they really going to look at where the individual lives?
In response to Labelle's letter, the FIQ wrote on social media that the minister finally recognizes that care professionals could be moved against their will, considering that the government will be able to unilaterally change the workplace while respecting the position.
Mobility is nothing new. It's not some innovative strategy that we've never tried. We've had float teams in the healthcare system for decades now. And what's really important to ask ourselves as a society, but I also wish that politicians would ask themselves that question: why are we in such dire need of nurses on certain units in certain areas where there's a real gap, where there seems to be a real issue with retaining nurses?
My colleagues, a lot of them are either retiring or moving into the private sector because they feel that the public sector is no longer a fit for them.
The FIQ's 80,000 members have been without a collective agreement since March 2023. Last week, the union called the latest offer a step backwards from the agreement already rejected last April, and is asking its members to refuse overtime as of September 19th.
Get back to the table and ask nurses, our leadership, what we need.
In Montreal, Alyssia Rubertucci, City News.